Hello, my students, my followers of Doctors of the Future. I again return to you in a new video. Today I will explain for all of you about ASD. ASD, atrial septal defect. ASD is an abnormal communication between the two atria. Now I will see you in this. Also ASD here. ASD, abnormal communication between the two atria. It is allowing the blood to shift from the left to right atrium. A cyanotic defect. Why? Because O2 to CO2. Why from left to right? Because contraction in the left side is stronger than right side. Why from left to side? Because contraction in the left side began and after moment or half of moment in the right side begin. Okay. It is more common in girls than boys. Okay. Blood flows from left to right, oxygenated to deoxygenated, because stronger contraction of the left side of the heart. This causes an increase in volume in right side. Why increase volume in right side? Now to explain to anatomy. If a blood shunting from left to right and also blood found from superior vena cava and from inferior vena cava, so blood here in right atrium will become more and more and more and more. So here this causes an increase in the volume in right side of the heart, as generally result in ventricular hypertrophy and increased pulmonary artery blood flow. Why? Because blood will enter from this valve, tricuspid valve, become here. When it become more volume of blood here, because this three-way from superior and inferior vena cava and from ASD, this will become more and more blood in right ventricle. So it will become hypertrophy here and will increase in pulmonary blood flow because large volume of blood ejaculate by right ventricle. Okay. Set the same as with a VSD. If you are as a student, your docent or your doctor in college ask you why ASD, same symptoms of VSD. Because ASD and VSD, all of them participate in one thing, that it is increase blood in right ventricle. Because VSD, blood will shunting from left ventricle to right ventricle, will become an increase of blood here. ASD, blood will become here. So in two defects, the result increase in the blood volume in right ventricle. So the two defects are same symptoms. Thank you for listening, my students. Thank you very much.